120,000 known cases in 114 countries.
In animals, some exotic.
Cases now that the country's abandoned its strict zero COVID policies. It had upheld
of their populations, only 7% of Africans have been vaccinated, according to the World Health Organization.
Vaccines are created through complex and rigorous processes that involve research, testing, and approval by regulatory agencies. Scientists start by identifying the disease-causing agent and determining how it causes the disease. They then work to develop a vaccine that will stimulate the body's immune system to recognize and fight off disease-causing agents. Once a vaccine has been developed, it must go through rigorous testing to ensure that it's safe and effective. This process can take many years, and vaccines are only approved for use once they have been proven to be safe and effective in preventing disease. There are several different types of vaccines, including live attenuated vaccines, inactivated vaccines, subunit vaccines, and recombinant vaccines. Vaccines are an important tool in public health care efforts to control and eliminate infectious diseases. They help to prevent the spread of the disease by providing immunity to a large number of people, which in turn creates herd immunity and makes it harder for the disease to spread. Vaccines have been responsible for the eradication of smallpox and the near eradication of polio, as well as a significant reduction in the incidence of other infectious diseases such as measles and chickenpox. The idea of using a weakened or dead version of a disease-causing agent to stimulate immunity has been around for centuries. The ancient Egyptians and Greeks both used a form of vaccination to protect against smallpox, a highly contagious and often deadly disease. However, the first modern vaccine was developed in the late 18th century by a man named Edward Jenner. Edward Jenner was an English physician and scientist who was widely considered the father of immunology and the pioneer of the smallpox vaccine. He was born on May 7, 1749 in Berkeley, England, and grew up on a small farm. As a young man, Jenner studied medicine and worked as an apprentice to a local doctor. He later attended medical school and became a licensed physician. When Jenner first announced his findings, his vaccine was met with enthusiasm from many people who saw it as a potential solution to the devastating effects of smallpox. Some of the key supporters of Jenner's vaccine included other scientists and medical professionals. Many scientists and medical professionals recognized the potential of Jenner's vaccine and supported its further development and use. They saw it as a major advance in the understanding and prevention of diseases, and they were eager to see it tested and implemented on a wider scale. Governments and public health officials also recognized the potential of Jenner's vaccine and supported its use. They saw it as a way to protect the health and well-being of their population, and they were willing to invest in the resources it needed to develop and the implementation of the vaccine. Many members of the general public also supported the idea of Jenner's vaccine, as they saw it as a way to protect themselves and their families from smallpox. Jenner's work was also met with criticism, as many people were skeptical of his ideas and resisted the use of vaccines, while others saw the potentials for vaccines to save lives and prevent the spread of disease. Despite the controversy, Jenner's work had a profound impact on public health and medicine. His discovery of the smallpox vaccine led to the eradication of smallpox, one of the deadliest diseases in human history, and his work laid the foundation for the development of vaccines for other diseases. Jenner died on January 26, 1823, at the age of 73. He's remembered as a pioneer in his field and a hero in the fight against infectious diseases. Vaccines have been a crucial tool in public health efforts to control and eliminate infectious diseases, and they have saved countless lives. However, vaccines have also been a subject of controversy and debate, and there are a number of social issues surrounding their use. Vaccines are an essential part of the public healthcare effort, and they have saved countless lives and prevented countless cases of illness and disability. However, despite the clear benefits of vaccines, there are a number of social issues and controversies surrounding vaccines, and these issues have been amplified in the context of the COVID-19 pandemic. There are a number of reasons why people might be scared of vaccines, including misinformation and fear-mongering. Some people may be scared of vaccines because they've been exposed to misinformation or fear-mongering about the risk and potential side effects of vaccines. This misinformation may be spread through social media, online forums, or other sources. It may be difficult to determine the accuracy of the information online presented. Personal beliefs. Some people may be scared of vaccines because they have a personal or philosophical belief that conflicts with vaccinations. For example, they may believe that vaccines are unnatural or they interfere with the body's natural immune system. Negative experiences or stories. Some people may be scared of vaccines because they know someone that had a negative experience or side effect after receiving a vaccine. While serious side effects from vaccines are rare, they can occur, and these experiences can be frightening and impact people's attitudes towards vaccines. Lack of understanding. Some people may be scared of vaccines because they don't fully understand how vaccines work, or the benefits and the risks associated with them. They may not have enough information to make an informed decision about whenever or not to get vaccinated. This misinformation and fear-mongering leads to vaccine hesitancy. Vaccine hesitancy refers to the reluctance or refusal to get vaccinated despite the availability of the vaccines. This can be due to a variety of factors, including misinformation about the safety or efficacy of vaccines, concerns about side effects, or religious or philosophical objections. Vaccine hesitancy can have serious consequences, as it can lead to lower vaccination rates in a community and an increased risk of outbreaks of vaccine-preventable diseases. This can be especially dangerous for people who are unable to get vaccinated due to age, underlying health conditions, or other reasons. There are several ways to address vaccine hesitancy. One approach is to provide accurate and reliable information about the safety and efficacy of vaccines. This can help to counter misinformation and allay concerns about side effects. Another approach is to address social and cultural factors that may contribute to vaccine hesitancy. This can include working with community leaders and influencers to promote vaccination, and addressing any specific concerns or barriers to vaccination in a respectable and non-judgmental manner. Finally, it is important to ensure that vaccines are widely available and accessible to all those that need it. This can help reduce barriers to vaccination and encourage more people to get vaccinated. The COVID-19 pandemic had a profound impact on the way we think about vaccines and the role they play in public health. The rapid spread of the virus and the devastating impact it had on the communities around the world have highlighted the importance of vaccines in preventing and controlling the spread of infectious diseases. One of the major ways that COVID-19 has shaped our perspectives on vaccines is by demonstrating the value of vaccines in preventing the spread of the disease. The development and rollout of the vaccines for COVID-19 has been a major focus of efforts to control the pandemic, and the success of these vaccines has shown the effectiveness of vaccines in protecting people from serious and potentially life-threatening diseases. Another way the COVID-19 pandemic has shaped our perspectives is on highlighting the importance of global collaboration and cooperation in the development and distribution of vaccines. The pandemic has shown the need for coordinated global response to tackle infectious diseases, and the development and distribution of vaccines has required collaboration and cooperation amongst governments, healthcare organizations, and scientific research institutions. Finally, the COVID-19 pandemic has also brought attention to the issues of access and equity in the distribution of vaccines. The pandemic has highlighted the need to ensure vaccines are available and accessible to all those who need them, regardless of their location or socioeconomic status. Before the COVID-19 vaccine was available, the environment was one of uncertainty and fear surrounding the virus. Many countries implemented lockdowns and other measures to try to slow the spread of the virus, and people were advised to wear a mask and practice social distancing to reduce the risk of transmission. Many businesses and schools closed, and people were asked to work or study from home whenever possible. It was a challenging time for many people. There was a mix of emotions when the COVID-19 vaccine was rolled out. Some people were relieved and hopeful about the vaccines, that they would bring an end to the pandemic and allow life to return to some sense of normalcy. Others may have been hesitant or skeptical about the vaccines, either because of the concerns about its safety or effectiveness, or because of the misinformation about the vaccine. It is important to note that vaccines go through rigorous testing and evaluation before they are approved for use, and the COVID-19 vaccine has been shown to be safe, effective in preventing COVID-19. It's also important to remember that getting vaccines not only helps to protect ourselves, but also helps to protect others, especially those who may be more vulnerable to the virus, such as older people or those with underlying health conditions. COVID-19 pandemic has highlighted the importance of vaccines in protecting public health and controlling the spread of infectious diseases, and has also brought attention to the social issues and controversies surrounding vaccines. Vaccines are an essential part of public health, and they have saved countless lives and prevented countless cases of illness and disability. Vaccines work by stimulating the immune system to develop immunity to a specific disease, and they are a safe and effective way to protect against infectious diseases. Despite the clear benefits of vaccines, there are still some people who are hesitant or reluctant to get vaccinated, and this can be driven by a number of factors, including misinformation, personal or philosophical beliefs, negative experiences or stories, and a lack of understanding about vaccines. It is important to address these concerns and provide accurate and reliable information about vaccines in order to promote the importance of vaccination to protect public health. By getting vaccinated, we can protect ourselves, our loved ones, and our communities from infectious diseases and contribute to the overall health and well-being of society.